Okay, so guys, welcome back. Still on top, your number one family entertainment channel. Like traditionally, every Saturday on top the show, we dey always look into the health segment of things. And for a while, or let me say for a couple of months now, Dr. Bass done dey talk about obviously wetin dey shele around the world, talking about the pandemic. And the truth is, I think this is just far from being over, because waking up to just within 2 days, we had a total of 767 cases. Every day, reality they done on us. And which way be the way? Wetin be the solution? That's now why we get the expert, the boss himself, when it comes to everything that you need to know on your health. Dr. Bat is looking so fresh and fly. This morning, you're not stressed out. You're not troubled.
Good morning. Good
you
morning.
Okay, no, doctor. Let me hold it from here.
Yes.
Let me hold it from here. How you doing, sir?
In the spirit of social distancing.
Yeah.
And physical distancing.
And face mask.
Yes. So mask up Lagos, mask up Nigeria. And on that note, I want to say a very good morning to you all, our viewers at home and around the world. Today we'll be looking at a topic we started some few months ago: coronavirus pandemic. Coronavirus pandemic. Just about 2 days ago, Nigeria recorded what at that time was the highest we have seen in terms of the number of affectation in a single day, in a 24-hour period. Nigeria had a total of 381 cases, and that was on the 7th of this month. Okay? But overnight, we had a figure that topped the last one. So at the moment, the latest figure we have in Nigeria is 386. And with that, our total number of cases in Nigeria has risen to 3,912, almost heading to 4,000. And just like he rightly pointed out, in just 2 days, we have over 700 cases. And then one begins to wonder, what are we not doing right?
That I've asked you.
Yes. And of course, that is why we are here today, to tell Nigerians what we need to do right, so that we can at least start seeing these numbers drop, so that we can at least see the curve flatten out in the next coming days to weeks. Also, in the last 2 days, the WHO African region actually gave some figures in terms of what we should be expecting, going by the modeling that they've done, going by a study that they've done concerning Africa. And they are saying that if containment measures fail in Africa, we are going to have about 44 million people affected in Africa in this year alone, in the first year of the pandemic. That we should be expecting to have in the neighborhood of 29 to 44 million infected individuals in Africa under 1 year of this pandemic. And we should be expecting to have in the neighborhood of 83,000 to 190,000 deaths. 83,000 to 190,000 deaths. That figure is frightening. Yeah. And what you and I we need to do so that we don't see this prediction happening in our lifetime is what we are going to concentrate on this morning. We're also going to do a little bit of some permutations with the number of available bed spaces that we have in Nigeria. Just yesterday, I did a telephone interview for one radio station in Abuja, and I was asked, what are Nigerians not doing right to reduce these numbers? Why are we seeing the increment, the exponential rises in the number of cases of infected individuals that we are still witnessing? And of course, I had one answer: non-compliance. 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 We would have loved to see the extension of the lockdown, but alas, the economic indices may not allow us to continue along that path. At least so we learned from our leaders. So they needed to strike a balance between continuing with the lockdown and easing with the lockdown in view of what the economic indices they have on their hands. And as a result of that, they took a decision that they felt would be the best for the country at this time. And along that line, they instituted a number of measures which they believe that if we are able to carry them out to the letters, we will be able to flatten the curve. And of course, that we are not seeing at the moment. For instance, the total number of bed spaces in Nigeria, we were told last Friday that is still about a little above 3,500. I said a little above 3,500 bed spaces in the whole of Nigeria because I do know that Lagos State has added 118 bed spaces in the last couple of days. At the new isolation center in Bagada General Hospital has additional 118 bed spaces. But that is hardly enough. Now, if you look at the number of active cases that we have in Lagos at the moment, the number of active cases that we have in Lagos as of 7th of May was 1,050 individuals. Total confirmed as of that time, of course, keep in mind that we haven't added the 176 that we saw overnight to this figure. So total confirmed at that time was 1,507 individuals were infected at that time. So the active cases was 1,050. Of course, among these numbers, these individuals, about 406 of them have been managed and discharged, and we are happy about that. We are looking forward to having a lot more discharges along that line. Evacuated, 2 people were evacuated, 16 people were transferred out of Lagos, and unfortunately and sadly enough, 33 people didn't make it. That was as of 7th of May. Now, if you add 176 for Lagos alone, going by the 386 we had overnight, the number of active cases in Lagos will go up to 1,206 active cases, or about that figure, in that neighborhood. Now, why am I saying so? Because between 7th and 8th, we have additional 10 fatalities, meaning that at the moment, we have 117 individuals have died as a result of this scourge in the country. So if you add 176 to what we had as of 7th of May, you have 1,000, at least above 1,200 of active cases in Lagos. Okay. Now, when you look at the available bed spaces in Lagos, going by the information or the statistics that were released to us by the Lagos State government, you discover that Lagos State has about 8 isolation centers, among which is 1 private hospital with 5 bed spaces for critically ill patients. Now, if you do a summation of those bed spaces, you have about 547 bed spaces. Okay, but they told us that the total room capacity we have in Lagos is 569. Now, if you subtract the number of people, yes, we have it. We'll have that on our screen now, 569. And if you look at that, you discover that the 569 bed spaces are not fully occupied. And yet we have a lot of people that are infected that are not yet in isolation. So the question becomes, where are these individuals? In the last 1 week too, the Honorable Commissioner of Health for Lagos State, Professor Aki Abayomi, also said that there was a disturbing scenario that was playing out in Lagos, that infected individuals are beginning to run away. Yeah. Runaway positive patients, COVID positive patients in Lagos. Where are they hiding? Why will anybody who is infected be running away? Keep in mind that we said countless number of times on this show, on this program, that 80% of people who may be infected with this scourge, or even above 80% of people who may be infected with this scourge, may present with little or no symptoms. So such individuals could actually feel well. So the major challenge we are having is that a good number of people are still not accepting the fact that this thing exists in Nigeria. So we have a situation where somebody will be called so that the results of such an individual can be communicated to him or her, and the person goes into denial mode. The person says, no, that cannot be possible. And as a result, the person will refuse to make himself or herself available for treatment. And such a person will be roaming the supermarkets, will be roaming the streets like you and I, and infecting a lot of other people. Also in Ghana, they've also eased their lockdown. And I can tell you that there was one industrial site in Ghana that had about 1,300 workforce. Over 500 of them were infected. About 533 individuals were infected in that industrial site in Ghana, a neighboring town here. As a matter of fact, let me also give us the statistics we have for African sub-region at the moment. So we do know that South Africa at the moment is topping the chart, is at the topmost of it all. South Africa is about the worst hit. So at the moment, South Africa has a total of 8,895 cases. The new cases they saw in the last 24 hours was 663. Egypt comes second with a total of 8,476 infected individuals. Total new cases was 495. While Morocco comes third with 5,711 infected cases. The total new cases they had was 163 individuals. Algeria, 5,369 confirmed cases. Total new cases for Algeria was 187. And of course, our next door neighbor, Ghana, now has a total of 4,012 infected individuals in that country. And in one single day, Ghana recorded 921 infections in one single day. That one now is Africa's highest daily tally. And of course, after Ghana comes Nigeria with a total of 3,912. And we also do know that Nigeria recorded in the last 24 hours 386 new cases. And of course, so far, 117 persons, unfortunately, didn't make it in Nigeria. So the figures are not looking friendly at all. Now, it behoves on you and I. As it is now, I read in a number of our blogs that our destiny is now in our hands.
All man for himself.
So what can we make out of this? That is the question each and every one of us should attempt to answer. Government has said that along other measures, preventive measures, that we should all make sure that once we are in public, we should put on our face masks. And these face masks must not be done in isolation, along other preventive measures or protocol, which of course include frequent washing of our hands with soap under running water for at least 20 seconds. Disinfecting all hard surfaces in and around us, around our houses, around our offices, in our cars, at all times. Also, maintaining social distancing, physical distancing of at least 2 meters. 2 arm's length from each other. If you can't do the summation of 2 meters. Once you outstretch your hand and the person around you does the same, the distance between you and such a person, your hands must not touch. Okay, so that's a way a layman can actually, but you still see a lot of us getting into supermarket, getting into crowded areas. If you have the best of face mask, N95, and you're in a crowded place and someone sneezes, it can only protect you to about 95%. So there are still 5% chances that you can pick it, even with the best of face mask.
Okay, doctor, I think I showed you up a bit. Let's quickly go for our break so that we can open our phone lines and obviously people will have the opportunity to ask questions because I know they are already waiting with their questions. So we'll go for this break. When we come back, numbers will be on the screen and then you can call through.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit also advertise your product and services on top we show where dey help people. Terms and conditions apply sha o.
Wet your hands with water. Apply soap. Rub your hands palm to palm and wash the backs of both hands and in between your fingers. Then palm to palm with fingers interlocked. Clasp your hands together and rub. And then clean around the thumbs too. Rub your fingertips in the palms of your hands and finish off with the wrists. Rinse your hands really well with water and dry them thoroughly with a paper towel. Use the towel to turn off the tap. Your hands are now clean.
Thank you so much for staying tuned, still on top of your #1 family entertainment channel. Of course, thank you so much, Dr. Bat, for always
Thank you
informing
very
us,
much.
even with videos. Okay, so straight up, the numbers will be on the screen now. You feel free to call and, of course, ask your questions. I've got a couple of questions to also ask the doctor. This morning, 08173147589, and, of course, 08105434984. Now, doctor, my first question, as a doctor, as a health practitioner, what advice do you have for the government? We don't deceive ourselves. Fact, I've said it, that the number of bed spaces, number of infected persons, actually more than the bed spaces now we have in Nigeria. So, as a doctor, what advice do you have for the government? That's number one. And then, secondly, we need to know the difference between isolation and quarantine, because a couple of days back, a number of evacuees actually got back into the country, and like what they said they are going to, I think, isolate them and all of that. So what is the difference between isolation and quarantine?
Thank you very much. Thank you very much for those two very germane questions. I must point that out. Number one, I want to start by appreciating the leadership of the country, the task force on COVID-19, ably led by Boss Mustafa, okay, as well as the frontline health workers. I must appreciate the work that they are doing. And of course, our own incident commander in Lagos, our able governor, is doing a wonderful work alongside his team members, Professor Aki Abayomi too. Now, having said that, my suggestion to what can be done at this stage, it's obvious from all the figures that we have marshaled out this morning, it's obvious that the number of infected individuals have gone past the number of available isolation-based spaces. No doubt about that. Now, the truth of the matter is that, assuming we were to have all infected individuals taking up those bed spaces, we'll still have over 600 infected individuals that bed spaces will not be available for, at least in Lagos State. So we have gotten to a crisis point. Okay, so what we need to do is that we need to change our modus operandi. We need to change our game. We need to step up our game. Now may not be the time to start putting together buildings in form of isolation centers. The easiest and the fastest is what we should go for. And that, of course, will be getting to see if we can get some hotels. If, of course, that will also bring us to the appeal that we can also, where we also at this point want to make further appeals. A good number of Nigerians have helped tremendously. They've donated massively to this cause. But a lot more are still needed. If we can get hotels, immediate accommodation, if we can get hotels that can provide accommodation-based spaces for isolation centers, that can help to cushion the effect. So that these individuals, should we be able to gather all of them in one place? Because the essence of containment, I must point out, when we are talking about containment, one of the things that you need to do if you're talking about containment is, number one, you need to test and test and test. And of course, when you test these individuals, you need to isolate the positive cases and put them in some certain places. The essence of doing that is to take them away from the community so that they can't continue to spread the virus from one person to the other. And when you take them into isolation, of course, you will start their management. A good number of them, over 80% of them, may not actually require any major treatment per se. All what they will require is to have a form of symptomatic treatment should they have symptoms. But the most important thing is to keep them isolated from the rest members of the community. A situation where we have over 1,200 active cases in Lagos and only less than about 500 are in isolation is not healthy at all, because these individuals are not living in the moons. Apparently, they're in the society. They're in the communities with us. Okay, so that we need to take care of urgently. Now, talking about the difference between isolation and quarantine. Now, quarantine is actually what you do when you have people who are exposed and you want to keep them in a place. People who are exposed are people who may have come into contact with exposed individuals, or people just like the evacuees that are coming back, Nigerian nationals are being repatriated back home. Those people are coming from...
Let's take Simeon from SCT. Hello, Simon. Good morning.
Hi, good morning.
Good morning.
Morning.
Can you speak up for us, please? Hello?
You say what?
Okay, your voice there low. Please project. Speak up a bit.
Okay, I saw the number on one production, Health Matter.
Yeah, we are live.
You are showing it now.
Yeah, obviously we are live.
Yeah, they were talking about the virus that is happening now in Nigeria.
You are live with us.
Yes.
Do you have questions, please?
I don't have questions. I just wanted to call.
Oh,
okay. Thank you very much. Thank you for calling.
Okay.
So the evacuees, Nigerian nationals that are being repatriated at the moment, the first batch have come in from UAE, some returned from UK yesterday.
Yeah.
Arrangements have been made. Of course, Lagos, of course, you and I know is filled to the, about to be filled though. Okay. Now, some of them will move to Abuja and a number of other things. Now, mandatory quarantine is a situation where you isolate, where you keep individuals, let me not use the word isolation, keep individuals that are exposed to a particular disease or a medical condition. Those exposed individuals may not have the disease at that material time,
Okay.
but in the course of keeping them together for a period of 14 days for COVID, it could be much longer than that, depending on the disease entity we are looking at. So when you're keeping them for that period of time, if any of them develop symptoms, we have Paul from ACT. We'll come back to that.
Yeah.
Good morning, Mr. Paul.
Yes, hello.
Good morning, sir.
Good morning, ma.
How are you doing today?
Well, thank God.
All right, please go on with your question.
Yes, my question is this. I want to appreciate WAP TV for what they are doing.
Thank you
very
so
much,
much.
sir.
I appreciate you too for calling. Thank you.
Good. Please, looking at the coronavirus or COVID-19 of the thing, Nigerian, we are good at pronouncing, announcing, talking about a thing theoretically, but we don't see the practical. What am I saying? If you look at Italy, look at all other nations, we should learn from them. Have these things displayed on TV. The death toll, you see people carrying dead body. When we talk about infected case, you see treatment going on. You talk about doctors. We are seeing doctors on suit. We are not seeing doctors with these materials on their body attending to Nigerians. So the whole thing is making Nigerians to disbelieve these things. Coronavirus is real. We should do everything possible to make Nigerians see facts and not just figures. To make Nigerians see real thing, reality, and not just tomorrow you see. I'm surprised. I met a woman when I was coming. I just went to speak to somebody in this or something. The woman's son was he had a cut on the leg, and they treated the leg. I just intervened, and madam, he says it's a paper that's giving her concern. And what is your problem? You are looking somehow. And when I checked the paper, man, I am sorry to say, doctor, I saw COVID-19 with number. I said, what is this? He said, I should just go. It's instruction they are following. So the whole thing is beginning to look as if they are deceiving Nigerians. Show Nigerians what is going on.
Thank you.
Thank you very much. Thank you very much. Thank you very much.
I think we get to hear that every day. Doctor, what do you have to say?
Yeah, he sure has he has made some salient points there. I must acknowledge that. But having said that too, I also want to point out that a number of individuals who have been infected have actually come up to say we were infected. Some, their relations announced on their behalf that they were infected. And these are very well-known individuals that a number of Nigerians can identify. Okay? Look at the Atiku Abubakar's son, our one-time vice president. He came out to announce that his son was stricken at that time. Well, I'm happy that he's cured now. He has been discharged. And we're happy for the family. Of course, the Dokwesi family, we understand about 7 or 8 members of the family are stricken. And a number of them are undergoing treatment. We're also praying that they will recover. But I don't think, in health in medical parlance or in medical institutions, you cannot disclose anybody's identity without the person's consent. That cannot be done. But I do know that what he's talking about is that we could give a picture of people who are masked, who are under PPE. With that, you can't identify them. And then with people who, you can actually cover their faces if need be. I think we need whatever we can do to convince
Nigeria,
the man on the street that we have a challenge, a big challenge on our hand. I think we should go out of our way to do that without offending people. That's what I have to say about, without infringing on people's rights. Because we come across this all the time. I stepped into an electronic shop just yesterday evening to make 1 or 2 purchases. And right there, I could count a number of about 5 people who were not putting on face masks. In that particular, of course, I called the attention of the lady who should be the head in the place. And of course, I wasn't surprised with the answer she gave me. She brought a cloth face mask that was only meant for her table. And when I complained, she pushed it onto her face. Momentarily, she said she couldn't breathe. And of course, she dropped it again. And I was advising that she could get ones that could enable her to breathe well. But what she said next stunned me, that she doesn't believe there's anything like COVID-19. And I said, okay, why are you using this face mask? And right there and there, I had to reach out to the authorities concerned that preventive measures are not being put in place in your facility. Please do something about that. So that is what we should be doing from time to time.
We have another Paul from Anambra. Paul, good morning.
Good morning.
How are you doing today?
I'm okay.
All right, sir. Please go on with your question.
Okay. I just want to know this coronavirus of a 10. I feel
Hello? Hello?
I think we lost the caller.
I think you
we lost the call. Okay, so coming back to the question, because I actually want to deal with the question. So quarantine is where you keep, the arrangement where you keep exposed individuals, people who do not have the disease at that moment. For a particular period of time, should any of them during that period of time test positive, such a person will be taken out and be taken to isolation center. So for exposed individuals, you do quarantine for them. Sometimes it could be mandatory, like Nigeria is currently doing. And I think that is what we should have done long ago, earlier in the pandemic, and we never did. I'm also happy that the Minister of Health has actually come to acknowledge that it was an oversight, okay, for having not implemented that. But they are doing it now, mandatory quarantine for all the evacuees that are coming. Anybody that is coming into Nigeria will need to be kept on mandatory quarantine for at least 4 days, 14 days. Now, for people who already have the disease, they go into isolation. Okay. So isolation centers are meant for people who already have the disease, while quarantine centers are meant for people who are exposed but do not have the disease at that particular point in time. So
it's not like they undergo any form of treatment?
No.
But doctor, see, there was something I also saw on one of the reports we get to see, but let me take this person. Okoli, good morning.
Good morning.
How are you doing today?
I want to thank WAP for this wonderful program.
Thank you very much, Mr. Okoli.
We have in Madagascar. They have this app for coronavirus, and nobody has died in the country because of the efforts. And also at Senegal, they have their own locally made medicine. Why can't Nigeria import these things? At least the important thing is to save life. It's not the end just the means. So I feel that when we wait for the people to manufacture vaccines for COVID-19, why can't we get this one from there? And use it at least any help in Madagascar, which also available in Nigeria. We have somebody have them anywhere. And they can use it. At least they try before we not okay. So wait for September, October, December before we put to give us the vaccine.
That's true.
Thank you.
Thank you very much. Thank you very much.
And that came out in the papers.
Yes. Now he's talking about COVID organics. Okay. Now the COVID organics. The president of Madagascar, President Andre, okay, he came out to say that the drug was used to cure 2 people. You can quote me. That is very correct. That the drug, the Madagascar herb, was used to cure 2 people. And that in medicine is no science. I must be honest with you. WHO has said that people should not try. They've spoken about Madagascar herbal mixture. A number of studies are already ongoing concerning the Madagascar herbal mixture. As a matter of fact, it contains a compound that the regular artemisinin or artesunate that we use in the treatment of malaria has. Artemisia annua. That is the leaves that it contains. Of course, it was initially a Chinese herb, a plant, through which artesunate was discovered with a mixture of some other things. So it's actually a herbal mixture, okay, that they have there. But WHO says it is unproven. Okay, it's not yet proven that it can cure coronavirus. So a lot of scientific research needs to be done along that line. Now, concerning the Senegal, I also want to point out that I do know that Tanzania has actually, a number of countries are making purchases of the Madagascar herbs. It's as good as, okay, this thing may not kill us. Let's even try for all it's worth. Okay, so not that it is a proven treatment for COVID-19. At the moment, there is no proven treatment for COVID-19. But however, I also want to say that there are some encouraging results that the scientific community have been able to get from ongoing drug trials. The major one among them, the currently ongoing drug trials, is the one that was initiated and sponsored by WHO called Solidarity. Now, that Solidarity has over 100 countries of the world participating on that trial, and Nigeria is about joining the other countries of the world to take part in that trial. At the moment, only 4 drugs are being looked at. Chloroquine and hydroxychloroquine is one. Remdesivir, Ebola drug that was discovered or developed about 4 years ago, as well as 2 other HIV drugs with other combinations. Those are the drugs that are being looked at the moment. And they are getting encouraging results from Remdesivir. That is how robust, that is how massive a scientific trial could be. So we need to subject the Madagascar herbs, the Artemisia annua-based herbs that they have there, to this scientific examination or studies before one can say, okay, you need to know the efficacy, you need to know the potency, you need to know the safety. All of these are not known. Someone could drink that herbal concoction and end up with kidney failure. That's the honest truth. Now, concerning the discovery about testing that Senegal discovered, I was happy when I saw that. But I think the Director General of NCDC has actually thrown more light on that. We have Taiwo from Lagos. Taiwo, good morning.
Hello, good morning, sir.
Yeah, good morning, my brother.
Yes, sir.
Good morning, Mr. Taiwo. Please speak up.
Hello, good morning, sir.
Good morning. Can hear you. Go on.
Yeah, I want to thank the doctor for a nice job, a job well done.
Thank you.
Well done, sir.
Thank you very much, sir.
Thank you.
God bless you.
Thank you.
Also, I really want to commend the NCDC and the health workers generally. They are really trying their best. But I think there are more to do, and we have a long way to go.
Yes.
So I really think they still have to step up, and they still have to do more of enlightening. Of course, I do watch the PTF meeting they do every day. But I observe that in terms of disseminating information, most of the radios are not tuned into it. If not, most of the TV stations that pick it up, when they are talking about live program, I think it's supposed to be a general thing. Many people might not be accessible to TV at the moment, but I think radio, even without electricity, people can hear it. At times, if I'm watching, if NEPA took off light like this, if I can tune into a single radio station that will pick it up live, it will be a challenging issue. And what are we saying? When we are just talking about, it's all about visual TV alone. I don't know, maybe you understand what I'm saying.
Yes, so, you're making sense.
But I think there should be a means of communication whereby people across the world can hear it. Like that, it's not all about advertisement. But when the program is going on, people will be able to tune into radio station and they'll be able to hear it live across the world. By such, people will be able to be carried along, not only on TV and just I don't know. I don't know. Maybe you understand what I'm saying.
Yeah, we do.
Yes,
Sure,
yes.
we do. We get you. Thank you so much.
Thank you
Taiwo.
very much.
Thank
You've
you
made
for
a very
that.
strong point.
I would like to get the contact to the doctor personally. I would like to discuss with him personally, sir.
Okay.
Okay, thank you very much.
I think you get to see his profile on the screen, so you can just copy the number.
Okay, sir.
Yeah.
Okay, thank you very much. I'm sure the authorities are listening too.
Mm-hmm.
Just like
Okay,
what,
that's his number, though.
just like what he rightly pointed out. I must also commend the PTF. I think they've tried to do a lot along that line, in the sense that people are allowed to ask questions in our local dialects, and of course, when they answer the question, is also in our local dialect. Now, the essence is to make sure that the message is passed across, not just to those elitist group of people or the allies in our society, but the talakawas on the street who may not even be able to understand English. Okay, but I think the radio stations too could key in.
Yeah.
I wouldn't say I know a lot about that, whether it's happening already or not. We also need to involve our traditional rulers. We need to involve faith-based organizations, leadership of every organization that we have in Nigeria, be it corporate organizations, be it NGOs. We need everybody, all hands must be on deck to disseminate information along this line. That is the only way that we can clear the doubts that we currently have on the street. I move about in Lagos all the time. Usually, I stand and I take notice of a number of people who are walking without any form of protection whatsoever. Sometimes I will stop and then share face masks to a number of people and all that. That's my own little way of reaching out. We should all be doing so, okay? Sometimes I engage people. Why are you not putting on your face mask? Nothing like that. It's a fraud. It's a scam. They are not yet. They don't know. We need to step up the campaign. We need to step up the sensitization, the education of our population. We need to do that. It's only when one is convinced in a cause that the person can follow you. If the person is not convinced, he will only do it when the boss is there. As soon as the boss leaves, of course, he drops that. And that is what is happening. And I also want to, at this time, point out again that a number of people who are even using the face masks are using it wrongly. They are using it wrongly. Okay? If you take a percentage of people who are complying with the face mask, I think there shouldn't be anything close to 20% in the whole of Nigeria. You see a lot of people, they have the face mask, but it's hanging on their chin. You see some other people, they have the face mask and it's hanging on their forehead. And their mouth and their noses are open. Their mouths and their noses are open. That's not the way to go.
Okay, Doctor, thank you so much
Thank you
for
very
always
much.
coming to enlighten. Of course, it's going to be another one with Doctor next week, Saturday. So please keep a date. But thank you, Simeon. Thank you so much, Paul, Okoli, and of course, Taiwo, that called us from Lagos. We appreciate. Next week, we'll be here 1 to 5. I'll be on top 5 today.
So we'll see you next week.
Have a good weekend, guys.